I'm Kirsten Williams, a beef and sheep consultant with SAC Consulting.
Hello, I'm Fiona Crowden. I'm a Veterinary Investigation Officer with SRUC Veterinary Services.
Today we're going to speak about Cull Ewe Screening of ewes, and it's a fantastic tool that you can use to really try and understand what is happening underneath the skin prior to the next breeding cycle starting. So if ewes are lean at weaning time, then you require about 6 to 8 weeks for them to gain a condition score, which is about 12% of their body weight. And if they don't gain condition, then it's a really good idea to investigate what is happening prior to the next year starting.
If ewes aren't making up condition after weaning, as long as they've got adequate nutrition in front of them, we're thinking there's something else causing them not to be able to gain that weight. So that can be things like dental disease, lameness problems, or concurrent parasites like fluke or worms. Alternatively, it might be that they've got a systemic disease. So they're called the Iceberg Diseases. There's ovine pulmonary adenomatosis or Yaxicti, OPA, caseous lymphadenitis, CLA, Visna, MV, or Johne's disease. Those are the four that can cause loss of condition. Border disease is also an iceberg disease. It can cause production problems elsewhere, but doesn't generally cause ill thrift in sheep. So there's two main ways we can identify them. Some of the diseases, so MV, CLA and Johne's disease, have good blood tests. So we can take blood samples from a selection of cull ewes and look for those. OPA is much more challenging to diagnose in the live animal. And things like fluke and worms also can be a little bit difficult to just absolutely pin down that is the problem of the sheep's not gaining condition. So your alternative is to give us up to 4 sheep, euthanize them and then do a post-mortem examination. And that means we can look at the whole sheep and really drill down and find out exactly why that sheep is not gaining condition. And we can look for all of the iceberg diseases, as well as things like fluke and worms, dental disease. We look at the whole sheep and really assess what's wrong with that sheep and why she isn't doing what she should be doing. So the iceberg disease is a really good term. It means that what you can see happening is just the tip of the iceberg when it comes to that disease within your flock. So what you can see of the ill thrift in your sheep, that ill thrift can knock on and cause poorer growth rates in your lambs, can cause increased mortality, decreased production. You know, it can manifest itself in a number of ways, but by the time you're seeing a problem, that disease can have spread much further and be having a low-grade impact in much more of your flock than you really realise. So Cull Ewe screening can take 2 forms. We can do the blood sampling for Johne's, CLA and Visna. Usually 10 to 12 of your kind of thin ewes that you don't know why are thin, those are the ones you want to sample. Alternatively, you can take up to 4 of those and submit them for post-mortem either to your local veterinary practitioner or to SRUC, and we can do a full body examination and find out what's causing them to be thin. The advantage is we can look for all of the iceberg diseases doing that, but we can also fluke, worms, dental disease, we can look at everything during that post-mortem exam. It's a really holistic view of the sheep, and that's the advantage compared to blood sampling or fecal sampling, is that we can see the whole thing and everything during a post-mortem exam. The main advantage of identifying these diseases is that you can make really informed decisions about managing your flock. If you know that's there, you might choose to test a wider group to see how much of your flock is infected. You might choose to monitor it, but you can make really informed decisions by knowing things. I think there's a terrible temptation just to not worry about these things, ignore the kind of increasing numbers of thin ewes that you're having to cull, and you're burying your head in the sand, and when it comes to investigating a problem, you're going to have a much greater problem to have to deal with. The economic benefit is really just increased knowledge, increased awareness of what's going on in your flock, and the ability to make informed decisions about your culling policy, your replacement policy, you know, lots of different things, and with the way you manage your flock. You know, your vet will come in at this point and provide some really good quality advice as to how that impacts your flock and what the best way to mitigate the risks of anything that we found on the post-mortem exam.